Elia Therapeutics XGal-3 is a very unique selective apheresis column. Apheresis has two basic categories. One is non-selective apheresis, where the plasma is thrown out and exchanged with fluids, with electrolytes, with albumin, and the body will slowly generate and create the other component that it needs, immunoglobulins, different lipids, etc. This is used mainly in autoimmune diseases, but it's a harsh treatment, and it's really part of the very undeveloped approach to apheresis. As this shifted to more selective apheresis, different technologies developed. One of the technologies which is semi-selective is size exclusion. So, for example, there are such columns sometimes for removal of lipids, of LDL apheresis, but they also will remove things that are essential, including proteins, immunoglobulins, etc. The most selective columns are columns that remove one single compound. And these columns have to be based on a ligand, a catcher, a binder that can recognize one specific molecule. This is the case with the XGal-3. The XGal-3 has a specific antibody for galectin-3 that is attached to the resin, to the agarose medium inside the column, and it binds just to galectin-3. There is negligent to no other binding, and this adds to the safety and to the specificity and the power of XGal-3. For example, with plasma exchange, galectin-3 will be removed, but other compounds that may be counteracting galectin-3 will also be removed, and that's why you don't get the same effect. This has been a process of development that took years. We now have a column with high efficiency. We have shown in depletion studies that we are practically removing galectin-3 when we circulate plasma to a level of undetectable levels of galectin-3. It doesn't mean that there is zero galectin-3, but it's not detectable in the readers that we are using. We also showed, based on smaller columns that we tested, that it will be able to capture more galectin-3 that's needed in the treatment. And that's a big advantage. It means that the column can be used for a long time, for many hours, and doesn't have to be replaced. It makes it more efficient, it makes it more cost-effective for the hospital, and it makes it more powerful. So we are truly excited about this development.